Well, for more on this latest attack on the al-Shifa hospital, we're joined now by Dr. James Smith, a lecturer in humanitarian policy and practice at University College London. Dr. Smith, first of all, thank you very much for your time this evening. Now, the Israeli army is claiming a senior Hamas operative has been killed in the al-Shifa hospital raid. This is Israel's justification for the siege. What would you say to that?
I mean, international humanitarian law is very clear on this, that there can be no armed hostilities in and around healthcare facilities. They are protected spaces, even in situations of extreme violence, as we're now seeing across the Gaza Strip. My response simply would be that hospitals, healthcare workers and health infrastructure are to be protected under all conditions. And that goes for all parties to an armed conflict.
And we've been here before. It's not the first time the al-Shifa hospital has been attacked, nor any other hospitals for that matter. Israel insists this time that civilians will be protected. But is there not still fear for the welfare and safety of those inside? Because like I say, we've been here before and we've seen patients die.
Absolutely. I mean, those assurances are not strong assurances. Over the course of more than 5 months now, we have witnessed the better part of 400 attacks on healthcare and health facilities across the Gaza Strip. Those attacks have been perpetrated by the Israeli military. We have heard and witnessed instances in which patients have been shot inside hospital facilities. Healthcare workers have been detained. Many of them have disappeared. We still don't know their whereabouts. Recently, when the Israeli military raided Nasser hospital, we saw footage of healthcare workers stripped down to their underwear and patients being wheeled by Israeli soldiers in their beds outside of the hospital compound. As you mentioned, we've seen this already with al-Shifa, the biggest hospital in the Gaza Strip, so 700 bed capacity, hundreds of patients that are treated by healthcare workers in that hospital every single day. The risk posed to them, particularly given the way that the Israeli military have behaved and continue to behave in their aggression in the Gaza Strip, is deeply, deeply concerning.
And some would argue, Dr. Smith, that this looks like a pattern of systematic dismantling of the health system in Gaza. Does it to you?
Absolutely. There is no doubt in my mind that what we have witnessed over the last more than 5 months is an attempt by the Israeli military to systematically undermine and destroy the healthcare system. That is part of their strategy of making the Gaza Strip completely unlivable. And it's also part of their strategy of trying to tell the Palestinian people that nowhere is safe. As I mentioned, the healthcare system and healthcare facilities are meant to be protected places. If you cannot seek sanctuary in a hospital, that is a deep, deep form of effectively psychological warfare.
And what of the thousands of displaced Palestinians who, again, as we've seen in other instances, are seeking shelter at a hospital because they believe that a hospital is a safe place to do so?
Their health and their safety is also at risk. The same goes for, of course, patients in the hospital or people that are injured and want to access healthcare services. We have to bear in mind that the Israeli aggression continues in the north of the Gaza Strip. We have children and adults who are hungry, who are dehydrated, many people becoming sick now with malnutrition. We've seen more than 20 children have died of malnutrition, all in the north of the Gaza Strip. Those people cannot access healthcare at Shifa Hospital, which was one of the remaining places that maintained some very limited functionality, even under these conditions.
Dr. Smith, thank you very much for speaking to us this evening. Dr. James Smith speaking to us live from London.